So then, if AMH is a hormone that is not there primarily for us to look at ovarian reserve, what does it do? AMH is a growth factor. It is a cytokine, so it is a sort of chemical messenger that acts as a bridge between different types of cells. And they are actually a very crucial element for all sorts of function and development. AMH is produced in the female in what we call granulosal cells. So these are cells that surround the egg. And in the male, they are produced by Sertoli cells, which essentially fulfill the exact same function as the granulosal cells in the female. So in males and females, AMH is produced. And it's really interesting when we look at male and female gonadal function is that each cell that we find in the ovary can be mirrored exactly by a cell in the testicle that does similar things. So AMH is produced in both males and females. So what does it actually do? AMH in the brain induces formation of nerves that will produce the hormones that stimulate production of FSH and LH, those really crucial hormones that stimulate the ovary to function, and in the male stimulate the testicle to function and produce sperm. We know that if somebody has very low AMH, then the growth rates of these nerves in the brain that produce this hormone called gonadotropin releasing hormone, which in its turn stimulates production of FSH and LH, if the AMH is low, these nerves don't grow very well. Whereas if the FSH is high, these nerves proliferate, and we see this in animal models all the time. What else does it do? In the ovary itself, it mainly fulfills an inhibitory action. So what I mean by that is, in order for the ovary to preserve egg reserve, not all eggs are available for use at any one time. Most of these eggs are kept suppressed and asleep, and only a batch of those eggs are woken up each month, and those are the eggs that are available for use. The rest of these eggs are not for use, they are asleep, they are out of reach. AMH is one of these crucial hormones that keeps these eggs asleep. And one of the things we think happens with somebody who has chemotherapy, for example, is that there is destruction of the cells that produce AMH, and that suppression is lifted on the ovary, and there's more activation of eggs during chemotherapy than is good for the person, and therefore eggs run out more quickly. It's because more eggs and you get this massive activation of eggs. So AMH is a hormone in the ovary, or as a growth factor in the ovary, that keeps the ovary quiet. What does it do in the uterus? It's quite interesting. The reason why AMH is called AMH is it's anti-Müllerian hormone. So the Müllerian ducts are the ducts that ultimately form the top of the vagina, the cervix, the uterus, the fallopian tubes, and possibly the beginnings of the ovary. So anti-Müllerian hormone would imply that it prevents the formation of the uterus. And in males, it certainly does. We have seen patients who are male, who have mutations in their AMH, in that a male AMH doesn't work, or the AMH is not produced, or the AMH receptor doesn't work. And these males have uteruses, fallopian tubes, because they have AMH, which normally suppresses the formation of these ducts, not working. In females, the story is a little bit more subtle, in the sense that when AMH is actively inhibited, we know that it promotes the formation of that middle layer of the uterus, that muscular layer of the uterus. And yet, in the menstrual cycle itself, when somebody is developing an egg and growing an egg, high levels of AMH will actually promote thickening of the lining. So AMH, again, not inert. It is not an inert product, and it has quite crucial roles in formation of the uterus. What about AMH in pregnancy? And this is interesting because AMH levels do change and correlate with pregnancy hormone, HCG. We know that the higher the AMH, the higher the HCG, the higher the HCG, the higher the AMH. It's a little bit tricky for us to work out what is what and what is causing what. But essentially, given HCG is a hormone in pregnancy that promotes proliferation of blood vessels, a process we call angiogenesis, which is crucial for placentation, we think that AMH also has a role in how vessels form and how well placentas form. And what is interesting about AMH is that it is correlated with a molecule that we know changes when a person is pregnant and has preeclampsia, which is where the placenta doesn't work properly and people develop kidney issues and blood pressure issues. I mean, I say all of this, it's mainly because AMH is not just a hormone that measures fertility reserve. It is an active cytokine growth hormone that has really key roles in the body. And what's more interesting is that the more we elucidate these roles, the more we can see AMH as a possible agent for therapy. So for example, there are already trials, both in many animals and starting in humans, whether we can use AMH or AMH-like compounds to protect the ovary when somebody undergoes chemotherapy, because AMH has that really nice suppressive effect. So if we can suppress the ovary, turn the ovary off, bring it to sleep, will it be able to protect the eggs and make it less of a target for chemotherapy? And the more we understand about this molecule, the more we see how complicated it is, and it opens up new avenues of therapy related to reproduction. So it is more than just something for us to measure our ovarian reserves by.